Welcome back. The nationwide death toll from the cholera outbreak has now risen to 26. The Gauteng Health Department has confirmed another patient has succumbed to the bacterial disease in Hammanskraal. It takes the total number of deaths recorded in the northern Gauteng community to 24. A death each has also been reported in the Free State and another in Mpumalanga. Gauteng Health Department spokesperson Foster Mohale says that, well, that's National Health Department spokesperson Foster Mohale, who says that details on the latest fatality will be made public in a statement tomorrow. Let's talk more about the cholera outbreak in South Africa. Bring in Higher Health CEO, Professor Ramneek Ahluwalia. Professor, very good evening to you. Good to have your time tonight. The death toll continues to rise almost 2 weeks on. Did we underestimate this cholera outbreak from when it was first detected in the country?
Good evening, Tembi, and good evening to everyone. It's an outbreak, and a bacteria that is a waterborne disease, and once it's in the water circulation in a particular area where the water is contaminated with this bacteria, it bounds to infect a number of people in that area. So, and this is a fatal disease, if not treated early. It's one of those diseases which through generations have killed humans. It's not endemic in South Africa. It's endemic in many other African and Eastern African countries. And so, we see cross-migration of people in Southern Africa and Eastern African countries coming to South Africa. And the bacteria is quite known in endemic countries. And this cross-migration does pose a threat to us as South Africans all the time, because the bacteria has the proportion to travel into our country. And then, of course, what's happened in Hammanskraal is there is definitely a water sanitation spill-off where the fecal matter, or when we pass tools where the feces are, where this bacteria finds its way to go into water, and that's where it has found way into our infrastructure. And that is exactly what's happened in that zone, in that area where the bacteria freely circulated. And I think that's why we're seeing it stretched into a couple of weeks. We really believe that if authorities are now, we should be thinking and we should be seeing that is with effective water treatment being put together, because this bacteria can be killed through chlorination, through effective water treatments, the ultraviolet, the filtration, and our water treatment system, if recovers very quickly, the bacteria can be then controlled and spreading to other parts, and including in Hammanskraal. But it will take time because it's found its way in our water system.
How helpful, how useful is the quest to determine the origins of the outbreak in Hammanskraal at this stage, given the number of infections and the fact that there is already cholera detected in other parts of the country?
See, so obviously it's very important, when you know the origin, you actually start seeing, okay, whether it was a case that came from cross-border, which is possible through cross-migration of people moving in, when they move and they come from endemic zones and the bacteria traveled through that route. Or we are trying to then investigate, is it really a matter that we need to be very deeply concerned, which we are really concerned, is our infrastructure system or the origin of the bacteria inside our own country at this moment. It points out to our weaknesses, there's no doubt. It points around our communities that are living near the rivers, the informal communities, the proper toilet system, the proper waste management system, our sanitation system, our sewage systems, because these are the loopholes of where the bacteria finds its way to enter into the water management system, where the water is treated and before it's moved into municipal taps, which comes to every household. So I think the origin is very critical to see where did this bacteria find its way into our water system. And that is exactly where we will be able to then go deeper to understand how we should be treating this from a systemic perspective, so that it doesn't happen again. But the chances of South Africa being always around, the bacteria is always around, because of we know that our neighbors and our countries around us do have this bacteria endemic, and cross-migration is a reality. And so bacteria does fine, but our system must be able to contain it due to its being waterborne. And if the water-affected treatment remains, the disease should not be moving to homes or spreading like the way we've seen with this time.
I'm also curious, Professor, about the sort of conversations going on between yourself and your colleagues in the health space now about where we are with the outbreak and where we could go potentially. Is there an expectation that things could get worse, and what would that even mean?
So I think, Tembi, that's the reason appealing to a great channel like yourself, and you're doing a fantastic job, because educating our communities at this stage is very, very critical. It has happened. We are aware that cholera is around us in Hammanskraal. So people in Hammanskraal, people around Hammanskraal, because it's an outbreak in that localized zone, they need to be very, very vigilant and careful. Definitely, hundreds of people have been infected with this bacteria. Most of the cases are mild, but people need to know that the effectiveness of boiling water at this stage, ensuring that boiling water is taken in 1 or 2 days, because the bacteria can still be alive once the boiling phase, the 2-day phase is over. So replacing the water and reboiling is very critical. Using bleach, 5 ml of bleach in 25 liters of water, standing for 2 hours, kills the bacteria. Educating our communities about it. Should you have a sign of diarrhea, of watery diarrhea, absolutely like rice water, and you don't have pain because the toxin immediately, when it enters your body and touches your intestines, pushes the water out like absolute diarrhea, and that's why you have chances of high dehydration and your fatality chances are high. So early oral rehydration solutions, early phases of intravenous interventions, going to a medical facility and being able to present yourself early saves life. And I think this is the message that education can play very, very central to households, specifically in areas around Hammanskraal and in Hammanskraal, where the outbreak is actually circulating at this moment.
Professor Ramneek Ahluwalia from Higher Health, always a pleasure to speak to you, sir. Thank you.